My name is Melissa Mitchell. I am the Chief Innovation and Strategy Officer at HealthLinc.
Now, you were just on a panel that we were watching, and you were giving some very honest opinions about where you're seeing Greenway going in the next 12 months. What's got you most excited as you look forward a year from now?
Wow, most excited. I would say Pratap's message today in regard to where they're going next is very exciting. The people that they're partnering with, the ideas that they're willing to get on board with, they're talking AI, they're talking, major web strategy. I love the idea of taking this product and making it so much better.
And Pratap mentioned a bunch of pillars of his strategy: customer service, product stability, and a few other things. What one area do you hope that they will really put a focus on in the next 12 months?
So they have to do a lot with regulatory, and I understand that. Everybody does. That's our world right now. But if we could put that on the side of things that have to be done but aren't as interesting, I would like to focus on the stability and then the customer experience. For us, being able to have a very efficient and quality product is really where I'm interested in seeing them go next.
You mentioned customer experience. I'm going to extend that a little bit and ask you about patient experience. How is that for you in terms of a priority? Is it a relatively high priority? Is it relatively low priority given what's going on right now?
Well, I'll tell you, in our strategic plan this year back at HealthLinc, the patient experience is the top of my list. Not just the patient experience, but also we need to put together a virtual patient experience so we understand how we can implement the new tools and technology coming out and roll that in as a total patient experience. So there are so many choices with healthcare today. There are so many places that we can go. And I'm a patient at my facility. I want things to be efficient and well run and easy to do, and I don't want to have to go in twice for the same thing. And all those things happen when an EHR works correctly. So it's good for the patients, it's good for the staff, and it's overall good for all of the revenue cycle because everyone doesn't have to spend money twice on getting things done.
Love it. We're here at Engage. What here has surprised you in a pleasant way that you've learned while being here?
Oh, okay. So I have to say first how excited I am to be back in the community, back seeing people. It's been so long since we've been together. So that is my primary excitable thing. Some of the other things I've been waiting for are the up-to-date
that's with Wolters
collaboration
Kluwer,
with Wolters
right?
Kluwer. Yeah, I can't wait for that. Our providers have been asking for that for a long time. It's going to be huge. There are a lot of great partners that are working on things that are going to be implemented into the product that are going to be maybe game changers. We partner heavily with Phreesia as well.
Okay.
And some of the items they're rolling out into and with the product, I think are just going to be really helpful for us as we work with our population.
Wow, you really are putting a big focus on patient experience when you're talking about Phreesia and the up-to-date stuff from Wolters Kluwer. Like, that's all around improving that clinical workflow, and it sounds like the flow in terms of the patients coming in and out of your facility.
Well, we're a federally qualified health center, so some of the patients, most of the patients we deal with are underprivileged, underinsured, they don't have the best health literacy. We really need to help them help themselves. And if they don't have the opportunity to engage in their own health care through things like education with UpToDate or virtual check-in or whatever, they can't do it as easily. So we're just taking down the barriers, and if we're able to do that, they're going to be able to get better.
Let's talk a little bit about that. It's one of my favorite topics, health equity. Given that you're on the front lines of this and experience this firsthand, what are some of the things that we can do as an industry to lower the barriers and reduce the friction that seems to happen with people who are in that category of, just unable to access care?
As an industry, now you're taking on the big guns. Okay, so as an industry, we need to stop making everything so hard.
Okay.
There's no reason that you have to have this specific process for a prior authorization. They know what needs to be covered and what doesn't. It shouldn't be so difficult to order things. Everybody should have interoperability. I shouldn't have to fax over and order 3 times so somebody can get a follow-up on a colonoscopy. They're already scared. They already are worried about what's going on, and now we're making the process to healthcare a challenge. And so when you're lost, when you're scared and you don't know what's coming next, if somebody puts something up in front of you, likely you're just going to stop. And so if we continue to create these barriers between people being able to receive the treatment they need and being able to talk to their caregiver about it, a lot more people are going to be a lot worse off. And so as an industry, if we can find a way to streamline the process and stop expecting non-health literate patients to become MDs so they can understand their own conditions, we're going to be able to move things a lot farther.
Amazing. Melissa, thank you so much for your time today. Really appreciate it.
Thank you for having me. It's been great.